Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about chronic pain. So if you or someone you know suffers from it, this is the episode for you. You need to hear more about how to treat it or learn more about what it is. Our guest today is Dr. Thomas Smith, the Chief Medical Officer at BioDelivery Sciences, a specialty pharmaceutical company working to deliver innovative therapies for individuals living with serious and debilitating chronic conditions. Dr. Smith, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Delighted to be here. Thank you for the invitation.
Dr. Smith, first of all, I hope you're doing okay in light of this pandemic. Has the virus affected you personally?
Like most people and most Americans and most people around the world, right? I've been impacted. I went through, many weeks of lockdown where I live. And, I think sometimes we forget that patients and folks living with chronic pain, but just people in general, right? They're dealing with the same mental stresses that all of us have dealt with during the pandemic, right? And isolation, loneliness, worrying about whether we'd get COVID or not. But thank you. I've been doing well and hope the same for you and your listeners.
I'm glad to hear it. So tell us a little bit about your background and how you got involved with pain management and pharmaceuticals.
Absolutely. So I'm a physician by training, and I'm boarded both by the National Board of Physicians and Surgeons as well as the American Board of Family Practice. I was in private practice for 12 years, most of that time in Alabama, in Huntsville, Alabama, and at that time was a headache specialist. And as such, I got involved with various pharmaceutical companies as a clinical investigator. So as they would develop new medications for patients with headaches, I would enroll patients into those studies and became an investigator for them. Also worked a lot with regulatory agencies around the world, like FDA here in the United States, and that was really an exciting time. It was a time when we were deciding, what is meaningful headache relief? Is it the number of headaches or the severity of headaches or the other symptoms that go along with it? And then after 12 years in practice, I joined the pharmaceutical industry, thinking that maybe I could use my skills and knowledge a little bit better to help even more patients around the world. So for the last 20 years, I've worked for the pharmaceutical industry, various companies, primarily have focused on CNS or central nervous system disorders. So I've worked on medications for diseases like multiple sclerosis, Parkinson's disease, Alzheimer's disease, epilepsy. And then for probably the last 8 to 10 years, my focus has been on trying to develop new and safe and effective medications for those people who live with chronic pain. So that's kind of been my journey, and it's been an exciting one, and it's been a great pleasure to be able to be of service to others.
So tell me, how are you making the distinction between chronic pain versus acute pain? How are you treating, or this pharmaceutical company, you're dealing with chronic pain, but what makes it different than acute?
That's a very important question. And so it is important to differentiate what is acute versus chronic. And most of the pain that we're familiar with is acute pain. So acute pain usually lasts for a few moments, sometimes minutes to days, and sometimes weeks. Acute pain is usually provoked by a specific injury or disease. Oftentimes injury, think of a muscle spasm, and it is self-limited and it resolves. In contrast, chronic pain lasts longer than 3 months or past the time of normal tissue healing, and it very well may be considered a disease state in some patients. So that's the difference. It's kind of 90 days or more is chronic pain and pain that persists versus acute pain. Both acute and chronic pain are enormous problems in the United States. Together, they cost around 650 million lost days of work here in the United States each year. And the financial cost is about $65 billion a year. As our focus today is on chronic pain, the CDC just published in November of last year the latest statistics. And what it showed was that in 2019, so prior to the pandemic beginning, roughly 20.4% of adults here in America had chronic pain, and 7.4% of adults had chronic pain that frequently limited life or work activities. And this is what we refer to as high impact chronic pain. What you'll notice if you look at the demographics of chronic pain and high impact chronic pain, that which limits our work or life activities, both increase with age, and they were highest among those adults who were age 65 and over. And also it's interesting that the percentage of adults with chronic pain also increases. Their place of residence becomes more rural, so out of the urban setting. So that's the difference. To kind of build on your question, there are many types of chronic pain. For example, chronic back pain, rheumatoid arthritis, osteoarthritis, fibromyalgia, and many other ailments, even cancer. And each one of these can have many causes. For example, someone with chronic back pain, that can result from years of poor posture or improper lifting of heavy objects. It could result from a congenital condition such as curvature of the spine, and certainly even a traumatic injury such as a motor vehicle accident. And then oftentimes there's no obvious cause at all. That unfortunately, sometimes it can be part of the ordinary aging process of the spine with degenerative changes. And that's why we see chronic pain more in the older adults.
So at what point should someone consult their physician about pain that they're having? Does it matter how intense it is or versus how long they've had this chronic pain? When should they consult their physician?
I think they should consult their physician or healthcare provider when he or she is having a difficult time identifying a certain instant where perhaps that pain was triggered or what caused that pain. If they don't know why they have the pain, certainly they need to consult their clinician. Certainly if proper care of their pain's not working. For example, if they're taking something over the counter like acetaminophen or ibuprofen, if they're using, ice and rest and compression, elevation, things like that for like an ankle sprain or something, if what they're doing is not helping and the pain is not improving or certainly worsening, then they certainly need to see their clinician. But again, most of us, will have an accident or do something to cause a little pain, and we can usually identify, right, what is it what's triggered this pain, and we just take good care of it ourselves and are able to manage it. But if it persists, if it worsens, or if there's no underlying cause, then I think one should see their clinician.
So tell us about the BioDelivery Sciences and what the company is all about.
As you mentioned, BioDelivery Sciences, we're a specialty pharmaceutical company trying to help those individuals who are living with chronic conditions such as chronic pain. I think people will come to find about us as an organization is we're very much patient-centric, right? Our focus is on improving, patients' lives through safe and effective medications. We currently have 2 marketed products here in the United States. One is Belbuca, which is for people living with chronic pain, and may be the right choice. Again, it depends upon the patients actually speaking to their clinicians. The second agent we have for patients with chronic pain, and it's for those people who have opioid-induced constipation from chronic pain or from their medications, we have a medicine called Symproic. So, we are continuing to identify, new therapies that, again, will kind of help those patients who are suffering from chronic pain.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about chronic pain with our guest, Dr. Thomas Smith, the Chief Medical Officer at BioDelivery Sciences, a specialty pharmaceutical company working to deliver innovative therapy for individuals living with serious and debilitating chronic conditions. So, Dr. Smith, you were talking about these medications that your company is offering. Are these currently on the market?
Yes, they are. So, these medications are on the market. They're available. Again, it's the decision of the healthcare provider and the patient, right, as to what's best for them. As we're talking about chronic pain, I think it's important, and I think your listeners will appreciate, and certainly the clinicians appreciate that something like chronic pain should be treated from a multifactorial approach. And even though we at BioDelivery Sciences, even though we do make prescription medications, again, that's best for the clinician to decide. And certainly, I wouldn't want anyone, making that decision on themselves without being educated by their provider. And I guess what I was going to was, I think in every case that with chronic pain, non-pharmacologic treatments or non-medications should be considered also first line. Things like just physical exercise, possibly, physical therapy. Other things that are very helpful in some instances are biofeedback, things like massage therapy, acupuncture, yoga, certain relaxation techniques. And again, I think this is a conversation for the patient to have with his or her clinician. And then when it comes to pharmacologic approaches or medications, there's a lot of options here too. As I mentioned earlier, one could try something over the counter like acetaminophen or like ibuprofen. Sometimes healthcare providers will elect to do steroid injections, and we've all heard about people getting steroid injections, and they do two things: they reduce the inflammation and they reduce the pain. And then there are prescription medications, and they're not just pain medications, right? So there's medications. Certain of the antidepressants help with chronic pain. Certain of the anticonvulsants, and then also medications like the opioid medications sometimes can be used for chronic pain. Again, depending on the patient's circumstances, and I think it's important too when we talk about opioids, because obviously we hear a lot in the press, but it's important, I guess, that the listener understands that our federal government schedules or classifies these medications based on their likelihood to be abused and or their ability to lead to psychological or physical dependence. And for example, a drug that is Schedule 2 has a higher likelihood to lead to psychological or physical dependence than a Schedule 3 drug. So again, I think it's nice for patients and people living with chronic pain to be educated of that fact, so that again, they can have those discussions with their healthcare provider when he or she is selecting their treatment options.
Do you think some people living with chronic pain hide it and not so readily willing to admit that they're in pain?
That's a great question. Absolutely. Chronic pain can stress relationships, marriages, friendships. People living with chronic pain oftentimes have feelings of helplessness or worthlessness. So they do try to hide it. They're embarrassed by the pain. It can oftentimes result in extreme financial burden due to loss of employment, medical costs, et cetera. And people that I talk to who live with chronic pain, they say that they feel guilty. Just very simple things and just simple displays of a physical affection, like giving someone a hug or even a handshake, can hurt. And so they feel like oftentimes that others don't understand how they feel. So, but to your point, yes, they do oftentimes try to hide it.
What would you say to a patient or someone that is experiencing chronic pain if they are afraid to take their medications that are prescribed because they feel like they will be addicted?
Right. And again, that's an excellent question. And I think that's a conversation that they need to have with their healthcare provider. I think it behooves all of us, right, to understand the medication that we're being given. Thanks to the internet and social media and the ability to surf the web and to try to gain information, I think we are more informed today than at any point ever in history. But it's important that we get the real data and the real facts. And so again, I think that's important to have that conversation with his or her healthcare provider, because oftentimes, again, living with chronic pain, you can be on medications for years. And, I know if it's me or my family, I want them to be on the medications that are least addictive, right?
So are you of the mindset that we should wean the patients off of opioids and move them to more of a non-pharmacological approach to chronic pain? Or do you think opiates are always appropriate long term? That's
an excellent question. There is no one size fits all treatment approach when it comes to patients living with chronic pain. I do think that we need to try as many non-pharmacologic approaches as possible. And I know in my own practice, when I used to care for headache patients, I would try to exhaust that list of possible non-medications approaches before I would move to a medication. I follow the science and the evolving science and developments with what's happening out in research and in laboratories around the world when it comes to chronic pain. And from my perspective, and this is my viewpoint alone, and I don't see anything replacing opioids as a class, probably for the next 1 to 2 decades. Because as you know, Doctor, it takes years and years of research and development to bring effective therapies to the market. So, and particularly as we look at the population of the U.S., we're a graying population as a whole. So we're going to see more chronic pain. So, opioids are going to be part of that armamentarium for the next decade or two. That said, I was mentioning earlier that the federal government schedules or classifies these medications based on their likelihood to be abused and or to become addictive. And I think it's important to use or try, perhaps, again, this is my point of view, but I believe it's important to try to use those medications that are less likely to be abused and or that we could become dependent upon. So I think that, but no, and the healthcare provider may deem that something even more potent, if you will, or at least even a Schedule II opioid may be necessary. But again, that decision's best between the patient and the clinician.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about chronic pain with our guest, Dr. Thomas Smith, the Chief Medical Officer at BioDelivery Sciences, a specialty pharmaceutical company working to deliver innovative therapies for individuals living with serious and debilitating chronic pain. So in general, is it safe to use medications past the expiration date or what's written on the bottle?
I would not recommend that. One should take their medications as prescribed. Those dates have data behind them. And so I would not recommend, and those medications should be disposed of. And again, one should consult with their pharmacist or with their healthcare provider as to how to dispose of those.
So if I have, for example, a husband or a loved one that I'm living with who is also dealing with a chronic pain issue, is it okay if I use their medication for my pain?
Absolutely not, because again, so many different classes of medications are used to control pain, not only opioids, but again, antidepressants, anticonvulsants. And without that medical knowledge of one, what's causing your pain, but two, and I know you're the exception, doctor, but without the knowledge of knowing what your pain is being caused by, and or what this medication is to be used for, one should not use another person's medications. No.
So can you tell us how to get in touch with you if we want more information about chronic pain or the pharmaceutical company that you're working with? How can we contact you?
Sure. So the best way to contact us and is through our website, www.bdsi.com. And on our website, you'll find ways to contact either me and my team through the medical department, or through our pharmacovigilance department, or the various other contacts with the department that one would need.
So what do you think are some effects that has had, with this pandemic that's going on? How has that affected chronic pain?
Wow, that's a really good question. There was a study I was just reading. It came out of Spain. It was a university in Barcelona. And it was, like I said, it was just published recently. And they were looking at more than 500 patients with chronic pain. And this study showed that 70% of these people had worsening of their condition during the pandemic. In addition, the study showed that these individuals had emergence of new triggers. So new things were setting off their pain or making their pain worse than in the pre-pandemic times. And as I mentioned kind of at the start of the program, like all of us without chronic pain, these individuals, these folks who are living with chronic pain also faced the same mental struggles that you and I faced during the pandemic, worrying about the future, having problems with sleep, feeling, just this insecurity, right? All the negativity, the loneliness, the fear of getting sick. So, that was an added burden to these individuals as well. And I think we oftentimes forget about this. And, you asked me at the start of the show how the pandemic's affected me. And I think about that, and then think about patients, again, not only with chronic pain, but anyone who's sick and suffering, having to deal with all that added stress of the pandemic. There was also an NIH report from last year that showed, unfortunately, many of the chronic pain services were deemed non-urgent during the pandemic. And everything from healthcare provider visits, people, clinicians who were doing interventional procedures, prescription refills, medication monitoring, basically all aspects surrounding the care of these patients were slowed down during the pandemic. So, hopefully, as we're slowly opening back up, and now with the fairly wide acceptance of telehealth in America, hopefully we'll see this disparity, if you will, turn around here in the very near future.
So what is the one thing you want to leave with our audience when it comes down to chronic pain?
I would sum it up as, I guess, again, my comment earlier about, there is no one size fits all treatment approach. It's certainly individualized. And I guess also for the listener to understand that, people who are living with chronic pain, they don't need advice. We're quick to advise people, I guess, especially when they have pain, because, we know a remedy or we think of something that might have worked for someone else. What these individuals with chronic pain need is they need understanding. They're looking for someone just to listen to them, to empathize with them. And, they're just seeking connection for someone to understand the hardships that they're going through. And probably the best thing to do is if one knows someone who's living with chronic pain, is just to check in on them and see if they're struggling with any activities that they need help with. And don't just ask if they're feeling better. Understand, I guess, that these folks are dealing with a chronic illness, much as someone who has diabetes or heart disease or other chronic conditions as well. And I think just showing that you understand them will mean a lot. And again, I guess in closing, it's just that for those folks who are suffering from chronic pain, to see their healthcare provider, their physician, or whomever, right, is giving them their care, and see if they, if their care would be improved by perhaps seeing a pain specialist or, someone who is highly specialized in this area, and then to take it one step further, and if they're dealing with chronic pain, to look for other resources, either from their healthcare provider or organizations like the American Chronic Pain Association or the U.S. Pain Foundation. Look for those resources as well, so that they can have a better quality of life and get back to their normal way of life, if you will.
Well, thank you for being here, Dr. Thomas Smith, the Chief Medical Officer at BioDelivery Sciences. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Thank you very much, Dr. Cook-Garard, and I really appreciate this opportunity. And thank you for your time, and I wish all the best to you and your listeners as well.
Thank you. This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.